chronic inflammation. In this video, I will talk about what to test if you want to find the root cause of your issues. Okay, so if you have low DHT, low 5-alpha reductase activity, or even if you have normal DHT but you are still going 5-beta pathways, if you had some brain injury, brain fog, erectile dysfunction, inflammation, low testosterone, inflammation can be the cause. And how to find out type of inflammation. Okay, so during the weekend I spent some time with my father. He's a doctor, and we talk about how we can detect inflammation. He's old school. Okay, so he told me that, for example, CRP and leukocytes, okay, so like VBC, are the only two markers needed to really detect inflammation. But if you watch this video till the end, you will find out if it's true or not. Okay, so CRP, C-reactive protein, and leukocyte VBC count are general markers of inflammation. Okay, but they don't tell you where the inflammation is coming from and how severe it is. Okay, so in this point I'm not agree with traditional medicine. Okay, so I work with many clients where I told them to test for specific markers. Okay, their doctors allowed at me. Okay, and finally they find out that other markers, even if like CRP, everything was okay, but the other markers were elevated and causing the issue. And if we fix the issue, everything's gone. People had improved their health after years of struggling. Okay, because the number one thing is to find the root cause. Okay, guys, because low testosterone. Okay, have you first take a look why you have low testosterone? Inflammation, I don't know, testis, toxicity, BPA, anything. Okay, so always go after root cause. Okay, and inflammation is a big thing. Okay, so I will for guys I will also tell you really interesting things at the end, so watch the whole video. Okay, so for deeper understanding we need to have, like I already said, specific inflammatory cytokines and damage markers based on your symptoms. Okay, is it gut, brain, autoimmune? Okay, so let's start with general inflammation. Okay, so inflammation markers, categories, and what they tell you. Okay, so we have this general inflammation and immune activation. Okay, we have three things. Okay, so we have CRP, C-reactive protein, best for systematic inflammation, acute and chronic. In my case, my CRP was always great, but other things, okay, that I need to fix right now are not so good, like ASLO. Okay, so it's for tonsil inflammation and so on. IL-8. Okay, so always you need to have some extra parameters. Okay, so but generally best for systemic inflammation, acute and chronic. Okay, but like I said, in most cases I need to fix two things that I know about. Okay, but my CRP is great. Okay, so ESR, erythrocyte sedimentation rate. Okay, it confirms chronic inflammation. Okay, so and then we have leukocytes. Okay, we have VBC count and differential panel. High VBC means bacterial inflammation, gut inflammation, chronic stress. Okay, so and low VBC can be chronic viral infection and suppressed immunity. Okay, so like I said, for basics we need to have probably CRP, ESR, and VBC. Normally, almost I think every doctors, if you go to the check after 2 years, will check this. Okay, so VBC is white blood cells leukocytes. Okay, so they are the immune system first responders to infection, inflammation, and stress. Okay, so and also there is a breakdown of VBC. There are neutrophils, okay, increase in bacterial infection, inflammation, and stress. You have lymphocytes, increase in viral infection, chronic inflammation, autoimmune disease. You have monocytes, increase in chronic infections, parasites, Lyme, gut issues, mold, okay? We have eosinophils, okay? If you have allergies, parasites, gut dysbiosis, okay? Basophils. If you have, again, allergies, histamine issues, or chronic inflammation. If VBC or white blood cells is normal, you likely don't have an acute infection, but chronic low-grade infection could still exist. And chronic, like I said, chronic low-grade is not good for erections, is not good for testosterone, guys, okay? So we need to fix, okay? So CRP and VBC are normal, doesn't mean that there is no inflammation. Not necessarily, okay? So CRP and VBC are good general inflammation markers, but they miss some hidden inflammation, especially in specific tissues, okay? So maybe brain, gut, mitochondria, blood vessels, and so on, okay? So like in ureaplasma, for example, okay? So many guys have this condition and they don't even know about, okay? If you don't test, you don't even know, okay? So when CRP and VBC might be normal, but inflammation still exists, okay? So chronic low-grade inflammation, autoimmune, gut, brain, may show up in TNF-A, EL6, EL1B, EL8, even if CRP is low, okay? So you see, it works like that, okay? Oxidative stress, mitochondrial damage, okay? So oxidative stress I see in many PFS guys. CRP won't detect oxidative stress, okay? So if you want to have great erections, you really need to know something about the oxidative stress, okay? Also, DNA damage or mitochondrial dysfunction will be not shown in CRP, okay? So you have another test like 8-OHDG, okay? So it's useful for that, okay? Watch this video till the end. I will explain how you can test, okay? So if you need my help regarding these things, if you want to really go to root cause, you can book a coaching with me, okay? So you'll find the link under this video, okay? Then you have things like neuroinflammation, okay? Guys, anxiety, brain fog, fatigue, okay? So you need to do things like S100B, it's more like about brain damage, GFAP, NFL, okay? So, and neuroinflammation, also IL-8, okay? So neuroinflammation will not be shown in CRP or VBC, okay? So for example, long COVID, IL-8, okay, so you will see. This is how I find out that I have, okay, I knew because I had really terrible depression out of nowhere, okay, and it was caused by neuroinflammation by long COVID, okay. So localized infection, gut dysbiosis, Clostridia, H. pylori, mold toxicity, Lyme, may not raise CRP, but can increase in IL-8, IL-1B, TNF-A, okay? So, like I said, if CRP and VBC are normal, you likely don't have major systemic inflammation, but you may still have hidden inflammation in brain, gut, mitochondria, okay? So, therefore, you need other tests, and let's go deeper, okay? So, deeper inflammatory cytokines, okay, for autoimmune, chronic inflammation, or gut issues, okay? This is the first category, okay? Like I already say, TNF-A, tumor necrosis factor alpha, high in autoimmune diseases, chronic infection, and gut dysbiosis like Clostridia overgrowth, okay? So, look, many guys can raise DHT when they, for example, successfully decrease TNF-A and EL6, okay? And they can raise DHT, because it can even block that kind of inflammation that can also block 5-alpha reductase activity, okay? So EL6 is involved in systemic inflammation, obesity, and chronic inflammation. Okay, so interleukin-1 beta, another parameter, high in autoimmune diseases, RA, IBD, neuroinflammation. Okay, IL-8, okay, high in gut infections, Crohn, IBS, or chronic bacterial infections. Okay, so best combo for autoimmune and gut inflammation is the first one, CRP, it's general inflammation, TNF-alpha, EL6, EL1 beta, EL8. Okay, so EL8 is also for brain. Okay, so another category, brain and neuroinflammation markers. Okay, so yeah, long COVID, ILS, PFS guys, so traumatic brain injury. Okay, so this what you should test. Okay, so GFAP, glial fibrillary acidic protein, indicates astrocyte damage, neuroinflammation, brain injury, MS, Alzheimer, mold toxicity. Okay, so S100B protein. Okay, so for example, if you have really bad sleep, maybe if you have apnea, this marker can be high. Okay, so S100B protein, but it's marker for blood-brain barrier damage, brain inflammation, and concussion recovery. Okay, so but also in apnea, guys, this can be high. Okay, so even if your sleep is really messed up, you will have probably high this marker. Okay, so neurofilament light change. Okay, so NFL, it's marked for nerve damage. Okay, so used in ILS, MS, TBI, long COVID, PFS. Okay, so yeah, like I said, also I know about my two sources of inflammation, and I cannot see it in CRP or normal test. Okay, so I needed to do specific test. Okay, so best combo for brain inflammation, GFAP, S100B, NFL, IL-6, and I think also IL-8. Okay, so another thing, oxidative stress, mitochondrial damage. Okay, so guys, really important. Okay, you have these problems in guys with oxidative stress. When there is a high oxidative stress, you have erectile issue, probably you are PFS guy. Okay, so also you have some kind of chronic inflammation. Okay, so there is one marker that I like to test, 8-OH-DG, so 8-hydroxy-2-deoxyguanosine. Okay, so it talks about DNA oxidative stress and is linked to aging, chronic illness, and neurodegeneration. Okay, so I have seen this high in many PFS guides, for example. Okay, so MDA, so malondialdehyde, lipid peroxidation. Okay, so glutathione levels, okay, low in chronic inflammation and toxin exposure, mold, heavy metal, gut dysbiosis. Also, right now I see in many guys, okay, so they have gut issues. Okay, so I have seen ton of tests recently, and glutathione levels are quite often very low. Okay, so best combo for oxidative stress, 8-OH-DG, MDA, and glutathione levels. Okay, so also one thing to oxidative stress and DNA damage. If you want to test, for example, this 8-OH-DG, okay, it's a urine test. Okay, you can do Dutch test, complete Dutch test, okay, or Dutch oath. Okay, so then also you can do things like organic acid test, oath. Okay, or you can also do standalone 8-OH-DG test. Okay, so so if you want to do hormone testing, you probably go for Dutch complete, and if you have suspected mitochondrial, gut, or neurological issue, then you probably do oath test. Okay, so guys, really, if you want to go to root cause, okay, the more tests you make, the better for you, because the problem with doctors is they do some basic tests, okay? But these basic tests, I have no problems with doctors, okay? They are great in general, but they are limited, okay? So sometimes we need to pay to really fix our health, okay? So if you really want to go deeper, things like oath, Dutch, blood, hormonal, VBC are needed, okay? So doctor, they will not tell you from alone to do all this kind of test, okay? So if you have then high 8-OH-DG, high oxidative stress, you need to fix, because you will run in many problems, okay? So some specific case studies, okay? So for brain inflammation, for example, the first thing how I find out about brain inflammation, IL-8, it was in my case when I had a long COVID, okay? So because chronic infection is affecting brain, okay, period, okay? So if you had any kind of these issues like brain fog, depression, I had from when I had this long COVID, in just few days, I went from normal being to extreme depression. It was extreme, really extreme, and it was because of the long COVID. I made a test and I have found out that I have brain inflammation. Okay, so you really need to fix chronic infection. Other chronic infection that are affecting brain are like mold. I see it in some clients. Lyme, for example, it was my brother. Okay, so viral infection like Epstein-Barr. Okay, Epstein-Barr has also effect on thyroids. Like I already said, long COVID. Okay, so also guys that have neuroinflammation, PFS. Okay, so they have brain fog, anxiety, depression, neurodegeneration. Okay, so IL-8 and brain inflammation. Okay, so even blood-brain barrier damage can be seen in IL-8. Okay, so also another thing. Okay, so some guys, they don't even know, but they have ureaplasma. Okay, so it's a bacterial infection. Also, if you have any kind of unprotected sex, okay, so oral or other things, okay, you can have this bacterial infection that is part of Mycoplasma family. Many guys, they don't even know, okay, and it's really bad because in the long run it is affecting urinary tract, reproductive system, even lungs, guys. Okay, so it causes chronic low-grade inflammation. Okay, so rather than a strong immune response like in other infection. Okay, so you will think everything is okay, and it's slowly destroying your health. Okay, so like I said, CRP and VBC may be normal in ureaplasma, but many guys have this kind of condition. Okay, so IL-6 can be higher. Okay, also TNF-A, even if you feel like joint pain. Okay, so if joint pain is present, it can be the reason. Okay, so IL-8 would be probably also high in chronic bacterial infection, including ureaplasma. Okay, so you can do also urine PCR for ureaplasma. Okay, and on top of that, you can also use IL-6, IL-8, and TNF-A. Okay, so guys, if you want to have higher DHT, for example, if you lower TNF-A and if you lower IL-6, okay, so any other inflammation. Okay, the treatment of ureaplasma is doxycycline, for example, one of the treatment, but in most guys it doesn't work alone. You need to also use other things that support the elimination of this bacterial infection, because it can be really strong, even Mycoplasma. Okay, so if you want to improve your health, then you definitely need to get rid of this. Okay, so that's it, guys. Probably the most comprehensive video on inflammation testing on YouTube. If you like it, hit the like button, comment, and yeah, that's it guys, bye.